Hey guys, this is Dr. Karan Zaveri, consultant OBGYN, obstetrician and gynecologist and a mom to two kids. Welcome back to my channel. This one is a special video for all the couples who are trying to conceive or get pregnant and who have so many questions regarding to fertility. So, when should you first visit your gynec if you are planning a baby? I would suggest that if your age is below 35 years, you have no significant medical conditions involved, and if your periods, if your menstrual cycles are more or less regular, then you can just try naturally for 6 months to 1 year. I would suggest during the initial 6 months, you don't even need to track your ovulation or do ovulation charting or anything, because see, nature takes care of itself. Your libido levels are very high during your ovulation periods. So if you just have intercourse when you feel like it, there are pretty good chances that you will just conceive like that. But for the initial 6 months, if you're trying like that and if you fail to conceive, then you should get your first visit to the gynec and just to understand what is fertility window, get a routine checkup and do some minor investigations. Now let's start with the questions that come very commonly to all the couples who are planning a baby. Question number 1. Which position of sex is the best if you are planning a baby? So see, actually position doesn't matter as long as you are ejaculating into the vagina. All the positions are equally good. Question number 2, is it important for the female partner to raise her legs and lie down after having intercourse? No, it is absolutely not necessary. The sperms can travel by their own intelligence, by their own motility. They do not need your assistance or your gravitational effects to guide them. Until the sperms are having good concentration, good motility, you don't need to do anything else. So question number 3, how frequently you should be having intercourse if you want to conceive? The answer is not, there is no such accurate answer, but mostly on a daily basis or an alternate day basis during your fertility window is good enough. This leads to our next question, what is the fertility window? So see, fertility window is the time period during which if you are having intercourse, that the chances of you conceiving a baby are pretty high. So what happens is, if you are having a 28-day cycle, then your ovulation will happen somewhere over 14th day. Then your fertility window will be from 9th day to 15th day. Now why is it so? Because the sperms have a very good lifespan. They can just stay in your fallopian tubes waiting for the egg to come for 4 to 5 days. Nothing will happen to them. But the lifespan of an egg is hardly 12 to 24 hours. So once it is inside your tube, it will just stay there for 12 to 24 hours and then you won't be able to conceive. So the fertility period or the fertility window is 4 to 5 days before your ovulation and ends 1 day after your ovulation. Now a very important question, what lubricant should you be using while having intercourse if you're planning a baby? This is important because not all the lubricants available in the market are sperm friendly. When you're purchasing it, just read the name hydroxymethyl cellulose amongst the ingredients. This is a very basic lubricant and it is good enough. So avoid using petroleum jelly or essential oils or even your saliva, because they do not kill the sperms per se, but definitely decrease their concentration or decrease their motility, so not advisable to use. Now we'll be discussing about a few basic health aspects when you are trying to conceive. So the first thing is diet. There is no special diet that you require if you want to conceive. Just a regular, balanced, varied diet is good enough. Next thing, exercise. If you are not exercising, then please just start exercising. Half an hour daily is really good. It will bring your health to an optimal level and it will also improve the quality of your eggs and sperms. Next thing is that is very important, is to bring your weight under normal range if you're not a normal weight person. So see, this is because underweight as well as obesity can lead to many complications in your pregnancy and you do not want that. So if you are not in a rush to get a baby just like that, then first manage your weight and then start planning a baby. Now, when we talk about supplements, what supplements are essential when you're trying to get pregnant? only one thing, that is folic acid. When you are purchasing the supplements, just try to read the name, either folic acid or vitamin B9, or it can be written as L-methylfolate. All these things are the same, and the minimum dose required is 400 micrograms or 400 mcg. The last thing that comes to my mind is that if you are having any kind of addictions or bad habits like smoking or tobacco chewing or alcohol, then you should stop them right away since you find your pregnancy. Thank you so much. If you like my video, do not forget to like, share and subscribe, and if you are having any questions, post them in the comment section below. I'll try to answer them. See you. Bye bye.